When it comes to discussing the health inequities facing communities of color and marginalized communities in the midst of this pandemic, there's one word that comes to my mind, and it is magnification. So this public health crisis serves only to magnify historical issues that we've known all along. The virus and the resulting economic shutdown are exacerbating longstanding inequities by widening the economic gaps and health disparities. And the impact, both physical and psychological, are likely to be long-lasting. As some early data have shown, the current COVID-19 pandemic is affecting all of us, even though it is not affecting all of us equally. This data is alarming, even if it reinforces research that's been done for years on racial disparities. The state data on infections by race show that the coronavirus has so far disproportionately infected and killed Black and Hispanic Americans. Multiple states show that more than half of the COVID-19 deaths are African Americans, and in virtually every state, the percentage of deaths of Blacks who die from COVID is larger than the percentage of Blacks in the entire state. And here's a statistic that we'll repeat tonight. As of June 2020, the CDC has just released data showing that Blacks are 5 times more likely to be hospitalized and Hispanics are 4 times more likely to be hospitalized from COVID than other groups. And nationally, the mortality rate of Blacks and Hispanics are at least 2.5 times greater than for other groups. So we aim tonight to raise awareness and understanding of this crisis and talk a little bit more about the whys behind these numbers, and then more importantly, talk about what we can do to make a difference. Regardless of how many times we've heard these statistics and this narrative, it remains painful to see up close. These are realities faced in real time by real people every day. Everyone here on this panel is committed to these issues and have been for quite some time now. So we're here to hopefully continue a conversation and a dialogue that we'll have for some time to come, and then help to provide some tools and perspectives to unpack some of this pain and find some purpose within it so that we can have a real impact for the communities we serve. It is an honor to introduce our panelists, and I want to start with a community care statement. We do have questions that have been submitted ahead of time, and if we have time, we will also look into the chat questions so that we can get some real-time engagement. But I'm just going to read this care statement. As a participant in this roundtable, we ask you to be respectful of your peers' thoughts and opinions. The intent of this roundtable is not to be confrontational or argumentative with one another, but to be a space where the UToledo community members can be their authentic selves and share their thoughts and feelings within a civil manner. It is an honor to introduce our panelists tonight. We have Dr. Elysia James, who is our neurocritical care specialist, John C. Jones, community advocate, community liaison in the Office of Social Determinants of Health, Erika White, who is the health chair of the Toledo chapter for the NAACP, Dr. Darren Gordon, who is our MD PhD candidate and former Speaker of the House for the Student National Medical Association, and Sadia Tahir, who is the newly instated Vice President of the new organization, White Coats for Black Lives, with a chapter here, which has almost 200 members, and is also the Barbershop Initiative Chair. So we can minimize the screen so we can see everyone, and we're just going to kind of start talking a little bit about these issues. And I wanted to start with, there's a lot of questions on a lot of data out right now in terms of the disproportionate impact on minority communities, but there's not a lot of consensus on the whys. So why do we have these issues? And what do you think are some of the most critical factors that have contributed to this disparities within the community? And anyone can jump in.
I'll jump in. This is John Jones, and I figured I'd get a jump on the two doctors in the room because I'm sure they have much more pedagogical explanations for some of this. But as we look at this, and I think it's a great question, and let me just say, Dr. Jenkins, thanks for coordinating this and for having us on here this evening. I really believe that some of the disproportionate impact, and it's not just belief, it's based in evidence, is largely due to obviously the underlying conditions that were present prior to COVID-19. And so for those of us that have been in this space for any period of time and have worked in community, that have worked directly with minority populations that are in lower socioeconomic status, populations that are dealing with various types of social determinant of health type issues, we've been ringing this bell for a long time. And so the conversation around the inequities that exist between racial groups, but specifically around chronic conditions, things that can be addressed and should be addressed, and quite frankly, should have been addressed for a while. These things have been there. And what is unfortunate is that COVID shows up and COVID lays bare the thin veneer that was blocking some individuals from seeing that. So what I don't like to hear and say is that COVID exposed something. No, it was already there. It allowed people to see it in a different way. And so when you talk about lack of access to healthcare, but more specifically, when you talk about lower unemployment rates or higher unemployment rates, lower employment, when you talk about inequitable education, you talk about food insecurity and the lack of finding good food, when you talk about poor housing stock, all of those things, when coupled together, is what now produces for us what we're seeing in our communities. And hopefully people, now that they see it, can begin to address it.
Absolutely. Absolutely. And it kind of echoes the outrage even with the social injustices seen on video, that these are things recently that have caused obvious torment, but they're things that we've known all along. So thank you, John. Anyone else want to weigh in on that? Why do you think that these disparities exist and have been magnified recently?
This is Erika. How's everyone doing this evening? So thank you for having me. I appreciate it. Got a chance to talk to Dr. Jenkins. Thank you.
Thank you.
To add on to what John said, is that I use a little tougher term called medical redlining. And what we've seen in our community is simply the same as we've seen within housing. We've allowed communities of color, particularly Black people, where we live at, to allow to be medical redline. Now, that redlining is not just specific to our zip codes, it's also specific to who we are. So even having that communication. So I look back into, if we go back beyond what we talk about as being chronic health issues, or any of the, we call it predeterminate, those that cause us, even though we're born, okay, you have this, you know that you have to put certain things in place in order for you to become diabetic or for you to have heart disease. So even the education piece, whereas in the Black community, we're taught that we can, and that we are very strong people. So that's just the first of all, we are, you either make it or you die. So we have that very strong drive. And we talk about, even if we had access, if we weren't being redlined, how many people would actually go to the doctor? Because there are many people that I talk to within the community that were still saying, I use my grandmama's tea. My aunt told me this. My granddad did this. So we also still, even though the medical field has grown, we still have a huge reliance. Even the most educated Black people still have what we try to self-diagnose, and we also try to medicate or take care of ourselves. And the other thing is how we look at our health. So we don't look at diabetes as being a killer, and it leads to death. After a while, we know that the insulin is going to break down other parts of our body. We don't have that talk. We just tell people in the Black community, and I say that personally because that's what I deal a lot with, is that we just tell them, you've got sugar, so this is what you need to do. You've got hypertension, this is what you need to do. So when we come in now and say, hey, there's COVID, what are people going to do? They're going to do what they always did. So along with the medical redlining, we also have the issue of where we have dealt with our health historically. And that's one of the other issues that I see in the community. Thank you.
Wonderful. Wonderful. Absolutely. Anyone want to weigh in?
Hi, my name's Elysia James, as Dr. Jenkins mentioned, and thank you again for having all of us. I find what's especially both painful and frustrating is living on both sides, so to speak. And so to Ms. Erika White's point, it is difficult to be a part of a medical system and attempt to address some of these issues by being a part of the system, and still realizing that there's this massive gap in both education, research, and understanding on all sides when it comes to health and medical resources and how we use them. And I find it particularly striking with one of the comments that was made in regards to how we actually see ourselves and how we actually see health. And for too long, people of African descent have been in a position where we don't see ourselves as important as we should. And unfortunately, our society has reflected that. And in turn, on top of all of that, there's been a longstanding history of distrust of the medical field, unfortunately earned, but now we're coming to a time where that distrust is literally starting to kill us and tear us apart. And that this distrust still persists despite allies being in that space to help. And it's been rough. I don't know if that speaks to how the disparities are created or why they're there, but I think both the pain and frustration are huge parts of this that, as you mentioned, Dr. Jenkins, are going to have long-term effects and toll.
Excellent. And we're going to talk a little bit about how to build trust, because I feel that that's a huge barrier in terms of delivering quality care, that huge gap between the provider and the patient, regardless of the demographic. Darren and Sadia. Darren, you want to weigh in?
Hi, thank you for having us, Dr. Jenkins. I wanted to speak on the point, besides the systematic social infrastructure and political landscape that's been in place that's contributed to some of these disparities that are present, that has been present for a long time. One of the other issues is that African Americans make up disproportionately a huge part of the workforce in America, and not just the workforce, but the essential workforce. So the workforce that has had to be outside during a pandemic. They make up about 30% of food delivery individuals, almost 30% of the U.S. Postal Service, and almost 30% of individuals who work in the food and restaurant industry. And on top of all that, there are roughly 2 million people, I believe, who, let me make sure I got that number right. Nope, I'm sorry, 3 million healthcare workers who are Black, and about 31% of them are home healthcare workers, and 30% of them work in nursing facilities. So these are huge numbers of African Americans and Black individuals who have had to be out there, who've increased their exposure to this virus. And not only that, because of the housing situation that we know minority communities live in, multi-generational households and other large household settings where there's a lot of individuals per square meter of space, it's contributed to a huge rise of COVID-19 cases and fatalities among Black Americans in our country.
Absolutely, absolutely. And those numbers are high. I read earlier this week in New York City, it's 60% of the essential workers, whether it's food or healthcare, whatever, are minority population. So the numbers are skyrocketing. I mean, if you're looking at a group that's 12 or 13% of the population, making up 60%, for example, of the essential workers, then you're even more exposed over and over again. And Darren?
Hi. So I think everyone has pretty much talked to all the factors that I would have named. I think one of the biggest things that we have to still kind of remember that at the end of the day, a lot of this is really about stress. Black people are stressed more because of obvious reasons, and that stress has an extreme physiological toll on our bodies. And so, whether it's trying to figure out how to, get housing or, where the next job is going to be, these things have foundational issues that just result in this, the healthcare disparities that we've seen. So, I'm always thinking about what we can do to really just address the fact that if we can minimize the things that stress us, which includes racism, police brutality, infrastructural inequities, then I'm confident at least that it will have a significant role on making a significant reduction in these disparity gaps.
And so let's piggyback on that when we're talking about stress. So if the stress is related to lower education or lower income or lower occupational status or all of these factors, or just systemic racism and just having to navigate going to the store without dealing with all of these other barriers and suspicions, for example, or getting in the car and worried about the interaction with the officer. I mean, it can go on and on. But the stress, these things, if these factors are existing, have existed for a long time, may exist for some time to come, how do you think you as a provider and as community leaders, how do we address that stress? What are the best ways for us to face that stress and try to overcome it if those X factors are not immediately removable from the equation? So we can't look up tomorrow and then systemic racism is gone, and then obviously all of these other factors, economic disparities, economic gap, unemployment, crime, all of these factors are there and we're working through them. But what are some of the ways that you personally handle it, or what are the things that we can provide to the community to help handle that stress?
It would suck for me to have to concede with dealing with the stress that will always continuously be there if we still have racism. If I'm paying into some system to reduce my stress, but the system itself is still adding on that stress, then it's kind of it's very cyclical and it's not really addressing the issue at hand. Now, that's only because we can't get rid of racism tomorrow and the effects of it. So it's just one thing that I always want people to think about is that as whatever our panelists are able to give, we still need to really knock out the issues that are for real issues.
Do you learn how to just live with it? That this is just something that's not going to go away? Anyone else want to weigh in?
I think one of the more, I shouldn't say the most, but I tend to speak in extremes and with my hands a lot, so I'm sorry. But one big factor to me is acknowledgement. I think we live in a society that still has a ways to go in actually acknowledging the foundations of not just this country, but North America, what our history really is, and not just from one perspective, but from multiple perspectives. Our story parallels what was done to the Indigenous people as well. I'm originally from Toronto, and so people tend to think in Canada we don't have these issues. And these problems of systemic discrimination based on people's appearance are widespread, not just in North America, but globally. And I think until we come to a local, statewide, national, real reckoning and acknowledgement of what this really is and what this means, I think that stress will still persist because you're forced to live in kind of a dual reality. where these things are happening, but they're not really happening. You just have to hustle harder, or you just have to be 200%, or you always have to be on, or you have to code switch. And I find what helps me deal with that stress is to frankly acknowledge it in whatever space that I'm in. As a physician and with, the strong interest in science, I think another area of hope is the amount of actual research that's now being dedicated to social determinants of health and how they affect different populations. So during my medical school training, you just get slides up that show, Black women are disproportionately at risk for cardiovascular disease, diabetes, dyslipidemia, obesity, breast cancer, and in every life expectancy slide, we're at the bottom, but with no explanation of really why. So there's something just inordinately wrong with being a Black woman, for example. And what's hopeful now is that in this current turn, with the protesting regarding systemic racism and police brutality, and the shift that's been happening, resources are now being dedicated toward looking more closely at those differences in life expectancy, real scientific-based research. And for those who are coming behind of me, and even me and those ahead of me, there's now an actual space more than ever where the actual data is going to show some of these answers and give some of the whys to our questions. And that helps. That takes the edge off of this discord. But again, completely getting rid of it, I don't know if that's feasible. And I don't know if our other panelists maybe have better suggestions.
Yeah.
Wonderful. That's
Just a thought, Dr. Jenkins and both of these doctors, Dr. Gordon and Dr. James, have spoken, quite eloquently to the space, and they've said it. I want to re-say it a little bit in a different way, based on what they just said, and I think Dr. James was really spot on, because what needs to happen right now is we got to call it what it is, and to do anything other than that. Is to, number one, provide space for individuals to not face and confront it. So one of my good friends, Erika D, says quite regularly that we have to call this what it is, and what it is racism. To call it anything other than that is to back away from the space and not lean in like we should. To call a thing racism is not calling a person racist, but it is speaking directly to the space. And when we talk about systemic racism, institutional racism, whichever way you want to phrase it, it's talking about those policies, procedures, processes that allow for marginalized groups to stay marginalized, right? And that's, sort of the simple space. You can go look up the official definition of it somewhere else. But at the end of the day, that is what we are living in. So, Dr. James, you spoke directly to social determinants, and I think that is the question, because if we look at, infant mortality, or we look at any one of these items, it is systemic racism that is causing it. If we look at life expectancy gaps, just in Toledo alone, the life expectancy gaps between the worst life expectancy we see, which is down in the 43604 area code, parts of 43607. I live in the 04, physically live in the 04. The life expectancy rate is 19 years less than our friends in Sylvania and farther out in West Toledo. That is in Toledo. That is not New Orleans. That is not Chicago. That is not Atlanta. That is Toledo, Ohio. And for all the folks listening, that is the key. And why is the life expectancy different? It is because of racism. It is systemic racism, and that is what needs to be addressed. Now, we can use the tools and methods, right, of working to educate and to create health access and to minimize or eradicate food deserts and all those things, and we can talk about that. We can definitely do that, but we really got to call out what it is, and that is systemic racism. And so as we begin to work through those issues, that is where education has to come in to help and assist, and I'm going to say this as kindly as I can to all of my brothers and sisters that are out there that are a little bit lighter shaded than I am. Nobody's calling, our white brethren and sisters racist, right? But what we are saying, right, is that the systems that have been established that has provided privilege to a whole lot of folks that don't look like me has to be dismantled and put back together in a way that allows for equity to flow through that space. And if that is not what we are going to do during this time, because we have a unique moment in time, and if we're not going to work on that during this time to ensure that all of those things that drive towards health inequities are being worked on to drive that, then yes, we're going to have the high levels of stress. We're going to have the high levels of other comorbidity functions that come along with this that hurt people of color more often than not. Will it get eradicated overnight? And I'll stop, but will it get eradicated overnight? Of course not. My personal belief, this is John's personal belief, and this is my preacher hat as well, is that racism will always be with us because hate in the heart will always be there. While we want to see it go away, some people will. But when we put in place the right processes to eradicate the systemic racist functions, we can minimize the harm from those who have hate in their heart against people that don't look like them. Do I think that they'll stop hating me? Probably not. But I can make sure that there's policies and processes and procedures that are put in place to minimize the harm that is caused to people of color, to people that are in lower socioeconomic status.
Well said, well said. And one of the things you said when you say just calling it as it is in and of itself, it just makes people so uncomfortable. Mm-hmm. So, that's just a common adage, grow comfort in your discomfort. Just saying the words themselves, much less getting to any solution, can be so bristling and so uncomfortable. And I think when you put it in the framework, well, this may always exist, how do we create an antidote for apathy? Because I think this is a moment that a lot of us are really kind of empowered in, where we feel we will create new organizations that did not exist and move closer to progress on some of our goals. But how do you maintain some type of real meaningful antidote for apathy in our communities and in our providers?
Go ahead.
You sure? You can go.
I just wanted to say thank you for acknowledging that piece with the apathy. Because this has been something that's been happening cyclically multiple times, not just in my lifetime. I went reading and looking the week I was born, something similar like this happened in Miami. And I have to admit, when I read that, and I'm sorry, similar to the current protests and pain and suffering in regards to police brutality. And when I saw that, to the week that I was born, I just felt a sense of overwhelming despair and, again, that lack of energy. Because it's like, how am I going to address this? I'm one person. This is a sea of stuff happening for centuries. And I think, again, one of the biggest ways to help combat that is to name it, is to say, yes, I'm tired, is to reach out and say, yes, this overwhelms me, is to confront that feeling of hopelessness and actually say, yes, this is how it feels. Because for a lot of times in our communities, dealing with some of the trauma that's come as a side effect of systemic racism, we've shouldered a lot and we've learned to say, oh, I'll just brush that off, or that doesn't bother me, or what have you. And again, that lack of acknowledgement is a burden that's killing us. And so to even just acknowledge, yes, I feel apathetic, gives you then a place to stand to say, but what can I do to re-energize? And panels like this help me re-energize. Going to work and advocating for my patients, even in the small sphere that I have, is re-energizing. talking these feelings out in safe spaces. So with my family and friends who not only understand me, but understand my story, is re-energizing. And it helps me to push forward. And I just wanted to go back to Mr. John Jones, his point, when he mentioned about dismantling systemic racism. For everybody, getting rid of some of these institutions and some of these things that have been in place will be an improvement for everyone. When we when we address suffering for the least of these, it improves the quality of life for everyone. Improving, I went to a school where we had limited access, and our elementary school was one of the first schools in my city that made our school wheelchair accessible. And for the first time, you could open a door without needing your hands. How much better was my life? Now I have use of both my hands. Thank God I have use of both of my legs, but my life is better now that I have automatic doors. So I learned really early that when we make sure that the people who need us the most have benefits equitably distributed, life gets better for everyone. So the problem of systemic racism, as complex as it is, also helps those who are not just at the very least, but also at the very top. These problems with COVID, other infectious diseases like tuberculosis that aren't going away, other pandemics that may be on the rise or coming also, will not go away. Violence will not go away. Systemic violence will not go away, and will affect everybody across the board if we continue to let it affect these one groups. These things are not contained. They affect all of us. And so that helps, that continual thought of that we're doing this together, and when we help this one group, all of us can get better, is also energizing for me and helps when I'm feeling apathetic.
Absolutely.
Sorry for the rant.
Ongoing. No, I agree, and I believe that because it's an ongoing. It's a marathon. It's not a sprint. It's not something that you just check off a box on a to-do list. Well, I've handled that, and I've dealt with my issues with racism and all these. It's something that's just an ongoing cultivation and care for ourselves, so that you're able to hit that door every day and meet those needs. Anyone else?
So I was going to say, thank you, Dr. James, for that. I think one of the things that can help get rid of the apathy is the realization that, these things won't change overnight, and the transparency and what people actually want to do, will do. I think it's one thing for, businesses or companies to say that we want to improve the climate, but what does that mean? How do we know you're going to actually improve the climate? And then how do we know that you're going to actually do assessments to show that you improve this climate? That's like literally one of the most frustrating things for me is when someone says they're going to do something, but they have, whether or not they have follow through, they have no concrete goals. So in the city of Toledo, I'm interested in knowing what are their actual concrete goals to addressing these issues. What is their timeline? What will happen if we don't address it? Those are things that even if we know that there might be issues, it will make a lot of people a lot less angry when they don't happen, because then we know that, okay, well, there's contingency plans, there's these other things that's supposed to happen in place. But when there's like, oh, we're going to increase the diversity in this group, how long is that going to take? And then also, are your measures, are your techniques for doing that, are they valid? Are they proven? It's just all these things that when there's no transparency and how things are happening, then it's extremely easy for it to become a situation of apathy. We're like, oh, okay, well, they just said they were going to change something, but we don't know what that means. We don't know how that's going to happen.
Thank you. Absolutely. And I think also when it comes to data, it can be empowering because it holds people accountable and stakeholders accountable. Where's the measurable outcome of success? How long will it take? Who is responsible for that? And so we can get into some of the ideological arguments and discussions, but a lot of the power comes in the data and how you're going to drive your decision making based on that data. I live in the city of Detroit. Everybody on the line probably knows that. I drive back and forth to Toledo. You can't deny the data of the mortality rate for African Americans in the city of Detroit. If they're 14%, you cannot, 14% of the state and making up almost 40% of the deaths. This is an undeniable statistic, and there is power in that. And I think that's something that we can really take advantage of. Sadia?
I've just heard recently that it's not okay to be not racist anymore, that in 2020 we now live in a world where we have to be anti-racist. And I think that's important for people like Dr. James and Mr. Jones and Dr. Gordon, who are speaking here about their exhaustion and their apathy. If other individuals who live in other spaces can commit to being anti-racist, hold their officials accountable, whether it's at the educational institution, at the city level, at the government level, wherever you work, whether you're a chef, a plumber, a student, if you start holding your space, the people in your space accountable, if you see something and you say something and you make sure that the school and the medical school that you're going to is the safest space possible for all students of color, then you're doing your job in this huge, what feels like Dr. James described, the sea of overwhelming, just this huge sea of problems. If everyone plays their own role and holds people accountable, then we can at least move in the right direction. And I wanted to make a point about stress that Dr. Gordon said. I cannot expect a Black man to wear a mask during a COVID-19 pandemic when he does not feel safe wearing a hoodie in the streets of Toledo, Ohio. So because of the police brutality, because of the systematic violence against Black men and Black women, this pandemic has, I just can't expect them to wear a mask when they don't even feel safe wearing clothes. You know what I mean? So it's just one of those things where we're trying to make sure that the minorities and the people who are being disproportionately affected by this pandemic are being protected from COVID-19, yet we can't ensure their safety while they're wearing a mask.
Well said, well said. Erika?
I wanted to come back into what everyone's saying and the way we do that, and I love what Dr. James said and everyone else saying. The big thing when we're talking about stress, and when I think about chronic stress, because we know what that has, chronic stress and what it does to our bodies, and why I think it's just become the norm that Black folk, we get this, and we die early, and all these things happen to us. And for the longest time, even myself, I thought that would happen because Black. You know, that's just what happened to Black people. You know, everybody gets diabetes, everybody gets, they get high blood pressure. That is just a normal thing that has become very normalized within Black culture. And if you talk to people in the community, you'll find one that goes out and works with people one-on-one. And so when we're talking about open up that dialogue, first of all, it has to happen, but we also have to be able to show the lines. You know, what happens when people are stressed? What happens when people are stressed? You know, like we have the numbers, and we have the numbers and we have the measurements, we have the facts, and the facts cannot be denied. So when you're layering on those layers of what is going on in the community, it's not hard to say. What does chronic stress do? It does this, this, and this. Where does it come from? That's easy. And I made some notes because I love what everyone's saying. I read a paper, and I'm not going to be able to pull it off the top of my head, and they talked about education, health, housing, and jobs. And they said those are the 4 big places where people have the biggest amount of discrimination and the biggest amount of disparities. And they said, just like what John Jones was saying, that if we were able to just get in there and start to unpack education or health, any of those places where we see these huge disparities based on race, we can really start to change where we're headed, because racism is the thing that is causing all of this. When we look back, why is it chronic stress? racism, high rates of diabetes, fatherless homes, everything, and there's so many more things we can go into, but just keeping it to health, a lot of that comes from racism, and it is now bled over into where it's being finally recognized, because we know it's been happening, and that we're recognizing it's because of racism. So we have to have that open dialogue. We have to change. When I say change, I always say, and there's the fierce urgency of now, we've all heard of that, but the further in the future that we want to change something, we have to start right now. We can't wait. And so if we wait, we're already into many of our children's generation, people saying they're very young. I get that, and that's important to me, which is why I do the work that I'm doing, is that how do we coalition build? We can't do it alone. First of all, we have to have coalitions. Some people also know that I'm also very much in the workers' rights, and that workers' rights are human rights. So how did we start putting that together? And part of that has to be recognizing how chronic stress is. That's the one thing we're going to talk about, how chronic stress leads to higher health disparities in the African-American community. It just does. And where does that come from? Racism. So just bringing down that message to little portable, I call portable pieces that people can start to unpack, and we can bring coalitions to help on making a big difference in where we're heading. If not, like it's something that we always talk about, we'll be having this conversation again and again and again. So tear down some things, like I always say, riot in healthcare, riot in education. If we're going to do a riot and we're going to burn anything down in our community and we're going to change things, then we need to be burning down and destroying the things that are definitely constructs where we are headed.
Thank you very much, Erika. Thank you. Now, we've been through our office inundated with providers and students who are not of color, who want to help and want to change. And we know it takes courage to face the realities that exist. But after facing these realities and having the awareness and doing the reading and the research and doing those things and confronting it, where do we direct students and providers from here? So does anyone want to talk a little bit about community initiatives and things that have been going on for years, things that they can tap into so that we're not exactly asking people to build from the ground up? There are programs, there are initiatives, there are movements already in place. And so does anyone want to talk about kind of how do we channel those who are aware and would like to face some of these challenges and some of this bias and have some real positive impact for underserved communities?
Yeah, I'll jump in there and then provide, because I heard Dr. Gordon say that he'd be interested in knowing what's going to be different this time around, and I think Darren, if I can just call you that, Darren, I think you are spot on with that question. I'm just a young cat, right? So I might look old. I'll take that. But I'm still a young cat too, right? But I'm old enough to know, because I'm a student of history, right? So I'm old enough to know some of the things that have gone on in Toledo, and I'm sure Dr. Jenkins can speak to stuff that's happened up in Detroit and ways in which we've seen this over again. And Dr. James, you spoke to it because you were looking back and seeing what took place the week of your birth, right? So what has happened is that these items are cyclical, and where I would say part of the failure in the work, and this is where we can make a significant change at this moment. I was not around during the mid-'60s, particularly around the Montgomery bus boycott and things of that nature, but there were structures built that allowed for sustainability and ultimately systemic change, right? And so what our folks went through during that stretch, and they were not perfect people. They did not agree on everything, but they agreed on one thing. They said it is not fair, it is not just that this particular experience continues to happen to us. And they said, we got to figure out a way to stick with it long enough. So what I'm thrilled about, and Ms. Erika spoke to it, is that you see a lot of the protests and you see a lot of speaking out in areas that are necessary. What must happen is that must be sustained, right? And so we've got to continue that voice. We got to continue speaking out. But in addition to that, we've got to build. And we got to build the structures that will allow for that to not only be sustainable, but also to have the effective impact. So the first thing I said earlier was that you got to call it out. The second thing is that now you've got to align the work that's being done with each other. So what am I saying? There's some folks that are doing some phenomenal work on the ground right now to address police brutality and reform around police and how they are engaging. There are some folks that I know that are talking through work that needs to be done around housing because of the inequities that exist around code enforcement and things of that nature. We've got an old and aging housing stock that needs to be lead abated. And so there's folks that are talking about how can we pour resources into doing that. There is real work that has to happen around education, and you've got experts sitting in that space. There's real work around job training and workforce, and how do you ensure that not only do I get a job, but I keep a job. Not only do I keep a job, but I can move from being that forward-facing essential worker into spaces that give me growing levels of responsibility, increased pay, increased benefits. Here's the challenge. Those things have to be aligned. I don't have to be the expert in employment or workforce to participate over in the advocacy section around police brutality. I don't need to be the expert in police brutality to come over here into this world and support those who are pushing hard on the health field. What must happen is that now more than ever, we've got to align those dots and create a strategy, a real strategy that folks know we can effectuate that strategy from the space that I sit in. And it also engages, and Ms. Sadia spoke to it earlier, the need for real allyship. I'm not talking about waving your hand and saying Black Lives Matter for 2 seconds, and then when you get in that corporate boardroom, you're like, nah, it ain't time for them yet. Dr. King spoke to white moderates who wanted to use their mouth to say, yes, you should do something, but not yet. He said that's not okay anymore. And if now more than ever, it's really not okay. So we got to call it what it is. Folks are going to be uncomfortable. That's okay. Let them be uncomfortable. But we also have to say, how do we align these dots with each other? If they ain't against us, we got to make sure that they're for us. And what am I saying with that? If they ain't out there physically fighting against what we're doing, we got to make sure that we're working to use the space that folks are in to advance the cause that we need to advance. I ain't got to sit down with dinner with you for you to advance that cause. I reserve dinner for close friends, right? I don't have to be sitting at the dinner table with you for us to be working together. What I do need to know is that you are not just non-racist, is that you are anti-racist. And I think I heard that said earlier, which means you are fighting against the systems and the structures that I'm fighting against. So there are several things that I know are happening in community, and we've got to be able to plug into those. And then additionally, and then I'll shut up, is that in our corporate spaces, right? So in our ivory towers and institutions and in our corporate spaces, we've got to make sure that there's a level of accountability there. So this time cannot be like last time. It cannot be, hey, I'm going to identify a couple people to do work around diversity because I know it's needed. And then in 3 years, you turn around and you look and no executives, no board members, no any of that looks like people of color. That cannot happen. But that means that folks have to work collectively together to ensure that the accountability measures are not only put in place, but that they are enforced. The same thing is true on police brutality and all those things. You can make a whole lot of rules and commissions and all that stuff, but if you're not enforcing the accountability, we're going to be here in 30 years. And I don't want to say that because I don't believe we will, but you got to enforce what it is that we're working to make change now.
Thank you so much, John. Absolutely. Because again, I think a lot of this is rhetoric and a lot of conversation, but I really look at what you're doing and how you're actually affecting change. For example, several students and providers reached out to the office, what can I do to help? And how can we protest? And all of those things are valuable spaces. In the meantime, in a week, we have these high school students who are socioeconomically disadvantaged, neither parent went to college, underrepresented minorities coming in. who don't even have laptops. So then you try to provide the laptop and then they don't have Wi-Fi. So we're talking about access, and we're talking about real practical things that can make a real practical difference in terms of shortening that gap.
And I would just add one more thing. The data is out there.
Mm-hmm.
You just have to disaggregate it. So
Yeah.
if we were to talk social determinants, and I mentioned infant mortality earlier, right? You can say, oh, hey, we moved the needle a little bit on infant mortality because the overall needle might have moved just a little bit. But if you disaggregate the data and our white counterparts got better when it comes to infant mortality, but our black counterparts did not get better, but overall the number looks better, if you don't disaggregate it, you can't get to the disparity. So when we talk about data, we've got to dig on the data and ensure that we use data-driven things that say, yes, we should target, and I think Dr. James said it, if we address the inequities for the least of these, we're addressing this issue for the larger group, and that's where it gets difficult. So we can wave around the data and say, oh yeah, we got better data, but if we didn't disaggregate it and look and see where those disparities exist, we ain't done nothing yet.
And I just wanted to just speak to that. And one area of hope is that that's what's happening, is that more and more and in an accelerated form, that disaggregation is happening. And in addition to that, the question of why is this still a persistent problem in this one group is being asked in the scientific realm more and more and more and more and more and more. And even in the short time that I've been in medicine, comparative like to some of my colleagues who've been in for 20, 30 years, I've seen that shift. And that creates hope for me. And I just wanted to go back to what both Erika and Sadia said about true allyship. For those of you who are listening to our panel tonight, even taking the time to listen and come in is huge. And I want to encourage those who may not necessarily look like the people or the group that's suffering or may not have the same socioeconomic struggles. I want to say to you, although this problem is big and it's complex, each person within their own sphere, especially if they're authentic, is enough. You can contribute and help right now, even with your wallet, depending on where you decide to eat. Chipotle has just announced a national campaign to specifically fund groups that address anti-Black racism. This is the first time, at least in my lifetime, I've heard of a national chain putting out there, this is what we're doing. Conditioner that I buy for my hair. There are companies that are now specifically stating, this is what we are doing. Your dollars matter. Where you choose to spend your money matters. And it doesn't, in this day and age, take away from the quality of the product that you're getting. There are allies out there. There are people, and Erika and Sadia, you guys said it so well because it has been one of the touchstones of my career and what's gotten me where I am today. There are people out there that do not necessarily look like the group that's fighting for justice, who is waging their own fight and feel disconnected. And I want to say to you, thank you, and that you are enough when you are authentically calling out these problems in your space. And as Sadia mentioned, when you call it out and you're not a minority, or you're not socioeconomically disadvantaged, or you're living in a place where you get access to fresh, clean water, great food, great outdoor spaces, when you in that space are calling these things out, you make space for those voices to be heard and more readily recognized. So I applaud you already, even if you're not necessarily out there holding up a sign. When you go to work and stand with your colleagues who are facing some of these problems and you address it with them, or even have those conversations, you are doing what you need to do right there. A second sphere, which I'm very passionate about, is becoming civically engaged. So a lot of these systems cannot be dismantled if we don't vote. Because I'm from Toronto, I'm not a US citizen, so voting for me has become a particularly passionate area for me, because as an adult here and due to my citizenship, I am not able to vote. And we have so many people who have that ability to vote without voter suppression and who still choose to disengage. And that is one huge area that I still think remains untapped, and that too many of us who are a little too comfortable aren't engaging at a level where we could. And that could really go a long way to dismantling some of these issues and some of these problems. So my two things would be connecting with your allies, encouraging your allies as they encourage you. And that encouragement may look a little different than what you're used to. And like Mr. Jones so eloquently said, we don't necessarily all have to come together for dinner, although I think eating helps a lot. But we do have to align where we have common interests. And right now, Black racism helps nobody. There is nobody that is serviced by police brutality, systemic racism, or violence. Nobody. So those of us who can align should. We already are. We're here. The data is being collected. It's being disaggregated. Scientists and people in STEM fields are looking at this and are exquisitely interested. And we need to become civically engaged. Use your vote. Use your wallet.
Well said. Here, Dr. James, absolutely. And I really like what you said when you address these issues, you make more room for others to feel comfortable in that space to confront this injustice. Does anyone else want to also kind of weigh in on community initiatives? I have Erika here, Healthcare, NAACP. I'm not going to waste this opportunity for you to show people how they can directly get involved.
So I love that, and I have to go back to what Dr. James said, and I agree with that. And I know that John said it also, and Sadia, I hope I said her name correctly, is that your vote matters and your money matters. So we always tell people that your vote matters. We forget to tell people that back end, that your money matters where you spend your money. So if you, and I'm gonna throw them out there, so Hobby Lobby is one of the places that I don't shop. Why? Because they don't believe in providing any health care for women. So when we think health care, the thing people always think about is abortion. That's not it. That's to get you off, and we have to be careful with the way people position things. So they'll say, don't support Planned Parenthood because they do abortions. Well, here in Toledo, you know, when you defund Planned Parenthood here in our community, they don't do abortions, but they do provide a lot of women's health care that is for women to come in and get their physicals or pap smears, or maybe you have something going on, or get birth control so that you can decide when the right time is for you to have a family. So when we hear these divisive terms, it immediately turns people, and we've got to get people back on that path. So when you say your vote matters, your money matters, there's the Ohio Unity Coalition. There is one of it's right across the University of Toledo. And what the Ohio Unity Coalition does, it goes in and not only gets people registered to vote, educates them about their vote. Because you can be pulled off here if you don't vote. I think it's 2 or 3. You don't vote in 2 or 3 primaries, then you are pulled off of the voting rolls, and people don't understand that. My own brother, okay, he thought, I had to get into arguing with him, that he thought because he was a felon and he's been out of jail for over 20 years, that he hasn't been voting. I mean, so these are, you know, people think, oh, I can't vote in Florida, so you can't vote in Ohio if you're a felon. Just having those conversations, because that's the way we've got a lot of disenfranchisement going on in the African-American community, is because we think our vote doesn't matter. And boy, has that worked not out for us. And I'm using words in order, but that's what exactly mean. It ain't working. So that is why one of the reasons that we have people in places, as John said, we get them to the table, yeah, and they get there and they don't say shit. And I'm sorry to be unprofessional here, but that's the truth. And so it's holding people that if you're going to get to that table and you're going to be my voice in the community, then you aren't you anymore. You are the voice for the people. You're supposed to be speaking for people. And so that's why everybody doesn't want me on their board, because I'm not speaking for Erika White right now. I'm speaking to the people out there, and all their English is not correct, and they don't know a lot of big words. But what they do understand is, how do I matter? How do I begin to matter? And connect with the Ohio Unity Coalition. There's also the Black and Brown Coalition, which I love, and they're coming together, NAACP and Flock. So if you haven't heard of Valdemar Vasquez, he has travels all over the world speaking on workers' rights, migrant workers. He lives here in Toledo. I mean, we have people sleep on Toledo. And let me tell you, right here, he's been to the UN and talked to them how we take care of people. He's even spoke about what happens with slavery in Africa still, what happens with slavery in other parts of the world, the Middle East, and he brings it home. And so if you want to get involved, the NAACP or FLOC, just going in there, they're looking for people to connect with the kids there. And if not, you can do the Black and Brown Coalition, which is working on how do we protect our communities. And it's not just saying fighting against the police, but teaching kids how to recognize things when they're dealing with the police to protect themselves and their families. There's also the Fight for 15. That's one of my favorite also, where we're saying, and that goes back to the economic empowerment. The Fight for 15, if you think about it, and this is where I'm going to get a little upset. People are more concerned about paying more than $1 for a pink slime hamburger at McDonald's. You know what I mean? They want to keep the price of the food low. And if food is cheap, we all know it ain't good for you. That's why if it's that cheap, it probably is not good for you, okay? It means that it has a lot of chemical fillers. It's not natural. And I don't know why things natural cost more, but they do, and I digress. But when we talk about that Fight for 15, when we talked about bringing the minimum wage in line of where we are as far as our gross domestic product, how much living expenses, raising the minimum wage to $10 ain't gonna get it. You know, in some parts it may, but we're talking about that $15. That's just bringing people to be able to walk through the door. We're not even making them whole. You're just saying, hey, maybe you can now think about not be so stressed, and you can help your children with their homework because you know you don't have to work 2 jobs. You can be home more. You can take care. You can get medical. If we offer people affordable medicine, then I'm not as stressed more because you know what? I can go to the doctor when something's wrong with me. I'm not just letting this go and you know what? I'm dying at 40 years old when I'm diagnosed stage 4 breast cancer, even though Black women aren't the highest. You know, we know the white women are diagnosed more, but Black women die of it more. There are things like that. So when we talk about the Fight for 15, the economic and social mobility, and that was a big campaign. It's not dead. The unions. So when we talk about unions, I'm very pro worker and pro union. And the reason why do they want to get rid of unions? Because that means the workers have the voice. I need to be paid better. I'm not safe here on my job. When we bring our voices together collectively, not only, and I think about this, I'm just going to throw it out there. If it was only about wages with unions, then why then are millionaires who play basketball, football, and baseball part of unions? Why are actors a part of unions? It's not about money. It's about your dignity on this job, and it's also about us saying, I need health care in order so I can be here every day. I need to be recognized that this is not safe when I walk into the space. When we talk about how those things then affect Black folks, going back what Sadia said, is from there. So whether you're going to choose, there's so many, and I know John can talk about the one as far as I'm not going to get it right, enter something faith. I can't think of the right word here, but there's a faith coalition with people of all different faiths come together. And it's not saying that you are saying I'm no longer, a Christian, I'm not a Muslim, or anything like that, or I'm not a Buddhist. What it's saying is that we respect the one thing, that we're here to do important work, and that work has to be done. So it's never about when you become part of a group. I always tell people, we're not here to assimilate. We're here to assemble something to make a change. And if we can't recognize everybody's voice and everybody's a little different, and we're not all going to agree, that's fine. Let's have family talk. I call it family talk. Let's put it on the table. Let's have that family talk. When we go out here, we're here to make a difference and make a change. So I don't like assimilation. We have to be together to assemble something greater. So there are a lot of movements there. You just got to choose which one it's going to be.
I love that, Erika. Assemble something greater. That's what I always think, too. People get so caught up in the destination. They're going to become culturally competent. They're going to arrive at this nirvana. And it's just an ongoing. You're trying to get better than you were last year and next year better than you are today. So thank you, Erika. And we didn't even really tap into, there's some work that you're doing related specifically to COVID, and I just want you to touch on that, too. The testing has caught up. We do know that in the data. I mean, African Americans with the same symptoms as white patients were 6 times more likely to be denied testing across the country. The testing has started to catch up. the disparities still remain the same. So what is some of the work that you're planning on doing related to COVID this fall?
One of them was my thought with COVID tracing. And again, I went back to school, which has been a challenge in itself because I really love health and wellness. And one of the things we talked about was COVID tracing. And it's been big with health and wellness. And where we look at that is that, okay, and I remember Ray Wood, and you can ask him, I did say this, we were having an NAACP executive board meeting, and they were really pushing the testing. And I said, okay, so you get testing, then what? And that's where I try to get people to think about the bigger things. So you get the testing, then what are you going to do with it? Are you going to collect data? Are you going to make sure people understand what testing means? Are you going to make sure the testing then is available because we know the writing's on the wall. I don't think you can give me pointers in the Bible where we had it right now. But the thing is, the COVID tracing, because I just believe that if you want to empower people, then you give them some responsibility in that empowerment. You can't empower people without saying, here's what I need you to do. That's true empowerment. It's giving someone a task to carry out that makes a difference, where they feel what they're doing has some meaning. That's who we are as human beings. That is what we search for every day. So with COVID tracing, if we're going to get people tested, and if you come up positive, then we need to say, hey, I think if you have the antibodies, that's awesome. Now, this is what we need you to do this is what we're going to do with the antibodies to help other people that may already be in the hospital, or that we want to go ahead and try to work on different vaccines. The other thing, if you're going to say that you are positive, who have you been around? Can you just take this piece of paper and here's your circles? And so we know that how the circle works, it's 5 days of symptoms. Some of the circles around you where people were, and we take that and we give it to people and allow them to be then empowered by taking care of responsibility to find out who else in our community has. Black folks are not showing up in droves to be tested. I think we all know that. And again, it goes back to, and I got to put back, Dr. James talks about distrust. It's a distrust. So it doesn't matter how many Black folks we show on TV doing it, they're going to be like, that's nice. It's taking it to the next level. Here's what we can do with testing in the Black community. We can move from COVID, we can move from the COVID tracing, tracing, and this is what it means, how we can build in our community, how we can take those numbers down. I don't think we're going to make enough change in the Black community when we're talking about systemic racism unless we really put in COVID tracing. And we know there is a shortage on people who are trained or understand the tracing and how it works. And we're not going to be able to do it all. So we're going to have to develop things to go into how do we empower others to help with that movement. And so that's what we're trying to work on. In fact, with UTMC, with NAACP, is how do we then get that data and put together the data in a way that not only educates people, because we know that COVID-19 tracing educates people, but empowers them to do other things. And when I say other things, make a change.
Wonderful work, wonderful work. I want to just, we're at the top of the next hour, and I think we could talk for a few more hours to come. I mean, there's just no slowdown in terms of the amount of things that we want to unpack today. But if each one of the panelists just wants to give like a brief closing remark, or even also touch on trust, how do we build the trust between those who we hope to serve and those who are providing care, please feel free, and we'll be continuing this discussion in further meetings.
Dr. Jenkins, I just wanted to chime in about the Barbershop initiative in Toledo.
Yes.
Ms. Robin Charney couldn't be here with us today as she was feeling unwell, and I just want to speak about it for just a few seconds and talk about it. She was a founder of this initiative a few years ago, and she's been in the barbershops in East Toledo working on blood pressure management with the barbers and the clients that come in. She's been working on prostate cancer screenings, breast cancer screenings for women. And she's been helping members of Toledo get health insurance for those who don't have health insurance. And she's getting members of East Toledo to go in and see clinicians when needed to meet. The pros for prostate cancer screening led to one individual being uncovered where he actually had prostate cancer. And I believe that is all you need to keep this community initiative going in these communities that are disadvantaged. And for my closing remark, I just want to say that to all the medical students here, I think most of the medical students in my class are pretty advantaged, and most of the medical students in my class will graduate medical school with flying colors and get into the most amazing residency programs and do the most wonderful things as future physicians. But I think getting through medical school should be the least of our worries right now, because we know that we can, for the most part, do it, and we will do it well. So I think the biggest concern that you should have right now is for the community that you're in, that you want to leave the community that you're in better than you found it 4 years ago in 2023. I want each of my classmates to be able to say that, because that's the role that we have. The 176 students in my class, if we all got into the barbershop, worked for the Fight for 15, worked with Ms. White on her NAACP initiative, got into the after-school programs and tutored the students who were disadvantaged, we can all leave Toledo a better place, and then all of the burden isn't going to fall on the people of color or just one person. So I just want to leave you guys with that. Please get into your communities. Please, I know you guys have so much potential. Please do good work. Please don't do it because you feel like you have to do it. Please don't do it because it's going to look good on your resumes or whatever. Do it because you want to leave this place a better place than you found it.
Thank you, Sadia. Thank you. Darren?
So I guess for my closing remarks, I just would charge everyone, if you haven't already, to just, like it was said before, do your civil due diligence. Talk to the community members if you can, but really talk to, or not, but really, but in addition, talk to those who take positions on leadership within our communities. I think they need to really hear that there's these big institutions that care about how our community is supposed to live and supposed to be. And if we're going to like city council meetings or trying to get in contact with the mayors or other, higher level officials, it shows the passion that we have, and it shows our potential to make some big change. So that's will always be my thing, is really challenge your leaders.
Thank you. Thank you. Anyone else want to give any closing remarks? Well,
So,
go ahead, John.
Just one, I just want to say thank you to you for pulling this group together. I know there's a lot of stuff going on just in general around Toledo and beyond, and for you to take time out to convene this group and also to convene such a great group of panelists, sans myself. And so I know there's a lot of folks that are listening, and the work that you all are doing, to Darren, to Sadia, to Miss Elysia, the work that y'all are doing there on the campus, have done and are doing, particularly within SNMA and all of those things. Please do not look at Toledo community and say, hey, we got to go get involved in the larger community. You guys are making the difference right where you are. Right, and getting involved in a larger community with all the things that Erika mentioned is important, right? And doing that is really cool, but don't minimize the change that you're making with all those folks that are coming through the doors on the campus of UT, through the College of Medicine, so on and so forth. Because let's put this in perspective. If they get to a good spot and understand the challenges that we're facing every day right now, and then they're deployed out into the workforce, and they're the physicians and the technicians and the nurses and so on and so forth of tomorrow, we're in a better place, right? Because the reality, and this is not to sound negative or morbid, but we've got a workforce that's going to be moving out. Folks are going to be moving out and retiring and doing this, that, and the other. And so we've got to keep flooding this field with as much folks that understand community and understand how work needs to happen. So I really want you all to stay really engaged and charged with the work that you're doing there. That excites me. And being in the space for quite a while, that excites me. The other thing that I would say is that we've got to ensure that we lift up the work that is happening in the community. So all the stuff that Erika mentioned is phenomenal stuff. There's work going on with organizations, and there's more work that needs to be done. So let me be clear, more work needs to be done. But when you talk about social determinants, the work that ProMedica is doing inside of that space around social determinants and food insecurity and things around that, those are critically important pieces. And there is more that must be done. And we've got to make sure we hold folks accountable. And we can't keep out the space. And I'll say this, and some folks get upset with me when I say it, but I say it without fear of contradiction. In the world that we are now living, if we compete on the space of inclusion and equity, we are literally nuts because we have not gotten there. So whether it's UT, Mercy, St. Luke's, ProMedica, Neighborhood Health Association, Western, and I'm going to mess up Celeste's group that she's leading. It's Western something. Somebody help me fill it in. I'll go find it so I can say it right. But she's got the work that she's doing there. There's so many pieces of work that are going on around health and beyond. We've got to find a way to connect the dots for people of color. And we can't do battle against each other if we're trying to lift all people of color. We got to make sure that we find a way. We got to hold accountable. So don't get me wrong. We got to hold folks accountable, but we also got to make sure we're lifting up when good work is being done. And so I would encourage that and keep pushing it. Again, Dr. Jenkins, much love to you. Keep knocking it out the park, doing what you're doing. And the same thing to each one of you on the panel. It was great participating with you.
Thank you. Thank you so much, John. Thank you. And
I just want to say real quick, to leverage, for those of you wondering, what can I do? Where do I go next? Feeling overwhelmed. Leverage the Office of Inclusion and Diversity. I know Dr. Jenkins I'm probably giving you and your staff more work, but these institutions did not just come out of nowhere, and we shouldn't take that for granted. This has come out of the needle, as frustrated and as negative as things may seem, and they are, and they're overwhelming, the needle has moved. There's an unprecedented amount of attention, energy, and resources being directed to these offices of inclusion and diversity. Inclusion and diversity is now impacting reimbursement. It's now impacting education, schools of higher education, their endorsements and their accreditation. These offices are here to help. Leverage them, look them up. It's as easy as a Google search. Another thing that's as easy as a Google search are local charities to be able to donate to. A lot of us are busy professionals. Even donating again with your wallet is an effective way to be a part of this without necessarily taking more time from your career, your families, or whatever else is your personal time that you're entitled to. Sadia, please don't kill me. But I am at the point now where I will even take people volunteering to make it look good on their CV. Because we're at a point now where each body helps, each person can work, and there can be change even in that experience. Even if you don't quite understand why you're there and you're like, oh, volunteering looks good, do it. There can be a change of heart. There can be a change in how you see things when you engage. So I will take whatever motive you have. I need you to, once it's legal and once it's not brutalizing or traumatizing anybody, but get engaged, and you can do it. And to my medical colleagues out there, wherever you are in your training, graduate students, university students, wherever you are enough in your current sphere. And the time you dedicate to continue to improve yourself and work on yourself and present yourself authentically to the space that you're in benefits all of us. And I was applauding silently to Mr. Jones's point. We need to come to a place where we stop minimizing what each individual person is doing. Each drop in a bucket makes a pail of water. The pail would not exist without each drop. And I want to thank and encourage all of you who are even just showing up in the space you're in, even when it's uncomfortable. And thank you so much. You guys are brilliant people. I'm so honored to be a part of this panel. Thank you.
Well said, and thank you.
And I'm going to tweet that, Dr. James, just so you know, each drop of water.
And Erika, did you want to mark? And I do want to say this is Erika's birthday, her daughter's birthday, and
she's over here, Jasmine.
Very last minute, really agreed to come on tonight. She's also on vacation.
We love you, Erika. We love you. Happy birthday.
Happy birthday.
Thank you.
Yeah, I think my family
come in on this panel, so please, I'm going to let you.
Thank you. No, thank you. And I think my family sometimes is like, are you on the phone again? You said you were off today. And I'm like, this has to do this one last thing. So, and a lot, it's a vocation. And that's what I wanted to add back into what Dr. James and both John said, is that, or Reverend Jones, that it's, you know, that it's a love, it's a vocation, that what we do isn't based upon money. Obviously, if you're in the medical field, you've got to already look at what part you're doing. That is a vocation, and I want to say I love you, and I appreciate the love you're giving. And when we think of love, we only think of it as, you know, kissing and all this stuff. And I always tell my kids, love is more than that. It's a commitment. It's a commitment, and it's an action. So think of every time that you are doing something, you are showing, displaying, and taking part of the act and the commitment of love. So we can never walk away and say, I'm just doing that. Every part you do, I always tell people there's no just allowed before what you're doing. You're not just doing something, you are doing something. And then keep that in mind as you move ahead. And and I want to get it right, the Student National Medical Association, I know SNMA, I want to say the correct, what that stands for. Thank you very much for even partnering with me with NAACP. I'm excited about the COVID tracing. I think we have really great ideas and being a part of the panel. Thank you for including me, because I know a lot of times people forget about health and wellness, and all they think I do is jump around in the gym or teach spin. But for me, like all of you on the call, it is a vocation, and we have each part, each piece matters. So continue to show love, continue to act love, and continue, as my pastor says, to bring about bold acts of love and keep that commitment. Thank you all.
Thank you very much to each and every one of you. You are leaders. You've been leaders. You've been making a positive impact. And so I just thank you so much for using your voice, your gifts, your talents, your resources, and making these sacrifices, which can really show a model for others in terms of how to move and how to affect real change. James Baldwin has a quote before we leave. Not everything that is faced can be changed, but nothing can be changed unless it is faced. So this is the first step, us having this conversation. We'll continue. I hope we can get this exact same group together for the next time. But thank you so much for participating, and then hopefully, I think, inspiring others to make some changes and actions. So thank you, and have a wonderful night. I look forward to the next discussion. Thanks.